There's no single cause of NPD. But, researchers agree that both genetic and environmental causes are at play. Individuals with narcissistic personality disorder have been found to have less volume of gray matter in the left anterior insula, the part of the brain related to empathy, emotional regulation, compassion, and cognitive functioning. It can be hard to resist the confidence, assertiveness, and excitement that surrounds a person with narcissistic personality disorder. But those same traits that drew you to that person in the first place may eventually become a turnoff when you start to notice the impact of their unemotional response to relationships, the cruelty of their lack of empathy for others, and the grandiose belief they are greatly important and should be treated as such.
Developed over time and through childhood experiences, genetics, and environment, says Dr. Hallett, noting that, as an adult, narcissistic traits on their own are not likely to develop into a personality disorder. Often, NPD will begin in the teenage years or early adulthood.
Personality disorders are typically diagnosed at 18 years or older, according to Dr. Hallett. The thing to keep in mind with kids is that some narcissistic traits are simply just typical of their age. Teenagers by definition are self-absorbed, and it doesn't mean they'll go on to develop a full-blown disorder. Scientists believe that the full onset of NPD may occur when interpersonal development is compromised, for example, being born with an oversensitive temperament, learning manipulative behavior from parents or peers, being excessively praised for good behaviors and excessively criticized for bad behaviors, suffering from severe childhood abuse or neglect, inconsistent or unpredictable parental caregiving, growing up with unrealistic expectations from parents, being excessively pampered or overindulged by parents, peers, or family members, being excessively admired with no realistic feedback to ground you with reality, receiving excessive praise from parents or others focused on your looks or abilities. What are the treatments for narcissistic personality disorder? For those who do seek help, psychotherapy, also called talk therapy, can help by working to increase empathy and compassion, says Dr. Hallett. Meeting with a therapist, you'll learn how to better relate to others, which can encourage more functional and improved interpersonal relationships, as well as gain a better understanding of your own emotions and why you feel the way you do. Along the way, your therapist might work with you on accepting and maintaining relationships with coworkers and family, tolerating criticisms and failures, understanding and regulating your feelings, minimizing your desire to attain unrealistic goals and ideal conditions. But don't expect a personality adjustment overnight. Treatment for NPD can be a long, slow-going, uphill battle, and just as with other personality disorders, patients may need to be more motivated than a typical therapy client to make progress and resolve their issues. While in treatment, those with this personality type tend to be mistrusting and reluctant, exhibit negative reactions, and often drop out early. Since the work deals primarily with personality traits, which are pretty steady over time, it could take many years of psychotherapy before a breakthrough happens. As they say, you can't teach an old dog new tricks. The good news is, studies in intervention with those living with NPD have shown that some narcissists are in fact capable of learning and feeling empathy, which is the ultimate antidote to the power of 4. And while there are no psychotropic medications to treat the disorder specifically, keep in mind that the likelihood of a co-occurring psychiatric disorder along with NPD is a possibility. If you are living with this condition and also dealing with depression, anxiety, addiction problems or substance use disorder, bipolar disorder, eating disorder, or any other illness, you may be prescribed medications that are helpful in treating these conditions.